Depo-medroxyprogesterone acetate, also known as Depo Provera, or the shot, is a highly effective birth control method, which means that it works really well. Depo Provera is 96% effective at preventing pregnancy, meaning that out of 100 patients who use it in a given year, only 4 will become pregnant. Without birth control, 80 in 100 patients will get pregnant in a year. Plus, if you make sure that you consistently use it correctly and on time, you can reduce your chance of getting pregnant to 1 in 100 in a year. Depo has commonly been given by a provider in a medical office as an injection into your muscle. But we now know that it is safe and easy for patients to give the medication to themselves as a subcutaneous injection right under the skin at home. That can make it so much easier to get your injection on time since you don't have to go to an appointment.
There are both positives and negatives to all birth control methods. In addition to Depo Provera being great at preventing pregnancy, some additional benefits include it's easy to use, long-acting, you don't have to remember to take a pill every day, it's private, it may cause lighter and shorter periods or no period at all for some people, it can safely be used while breastfeeding, and you can take it even if you can't take estrogen due to certain medical problems. Some potential side effects include heavier periods, spotting in between periods. This is more common in the first 6 to 12 months of use. Most women have lighter periods or no period at all after 6 months of use. You also see changes in appetite or weight gain, and some patients may need extra time to get pregnant after stopping the shot. You can also see bruising at the injection site. Some less common side effects include headache, nausea, sore breasts, changes in mood or sex drive, hair loss or hair growth, and changes in bone density that go back to normal after stopping the shot and have no symptoms. Keep in mind that everyone is different. Your experience with Depo Provera may not be the same as what your friend or family member experienced. The self-administered subcutaneous version of Depo Provera is easy to use. Start by washing your hands. Next, remove the syringe from the package and shake for 1 minute until mixed. Hold syringe pointing up and tap to shake out air bubbles. Then push syringe up until air bubbles are out. Next, attach the needle. Choose injection site in the abdomen or anterior thigh and wipe with alcohol pad and let the area dry. Take the cap off the needle and hold syringe in dominant hand. Grab skin around the injection site with non-dominant hand and insert needle all the way into the skin at a 45-degree angle. Press syringe all the way in and keep the needle in place while you count to 5. Remove the needle and dispose of the needle into a sharps container. Apply pressure to the spot with a piece of gauze or a cotton pad. Make sure to mark your reminder sheet with the date of your injection. You should plan to administer your next shot in approximately 13 weeks. However, you can give your next injection between 10 and 15 weeks from your last injection. You can use the injection calendar provided to see when your next shot is due. For instance, if you received your injection on January 1st, your next injection is due between March 12th and April 16th, with April 1st being exactly 13 weeks from your last injection. There are also many free smartphone applications, such as the Spot On app from Planned Parenthood, that help you keep track of your injections and remind you of when your next injection is due. You should contact your provider if you have any questions or concerns about how to give yourself the shot or are missing any supplies. You should also call if you're concerned that you may be having a reaction or infection at the injection site. This includes severe pain, redness, or pus noted at the injection site. Or should you experience any fevers or chills. Bruising can be normal. You should also call your provider if you experience any strong symptoms, such as severe nausea or vomiting, mood changes, or feel otherwise unwell following your injection. You should also call your provider if you think you may be pregnant. While not harmful to a pregnancy, Depo Provera should not be continued if you think you are pregnant. Contact your provider to discuss your options and next